Call the meeting to order of Program and Budget. A reading of the mission statement. Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And now a reading of the mission statement. Lori.
Oh. Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence.
Thank you, Lori. And an adoption of the agenda.
So moved.
A motion by Nick, support by Linda. All in favor signify by saying aye. Aye. Motion carries. And now a hearing of the public. Is there anyone from the public wishing to speak? All right, number 5, request to approve. 5A, request to approve moratorium of procurement policy directly related to request for proposal, RFP. Is there a motion?
Motion. Support. Motion.
Motion by Lori, support by Megan. And Dave.
Good evening, everybody. We do have an existing policy that we would like to revoke. And this whole purchasing policy is currently under review for update and renewal. But given the staff shortages within our network, the changes that we're going through trying to expand our network as quickly as possible, we would like to void this current one and allow us to basically get the contracts out to the providers faster. Those contracts would still go through the normal process, but we'd no longer have to do the ask you ahead of time for the RFP going through. We did have that's all we're asking for on those. If there's any questions, I'm happy to. Donna? Sorry.
Donna?
So, are you asking to permanently void this policy?
We are currently working on revisions. So I've learned we are not bound by the county's procurement policy. So what we've done is we had an older purchasing policy and then a contracting policy, and all of those are being reviewed and updated right now. So I've been working with the county. We have our purchasing policy also needs to be updated to correspond with our new general ledger, the way that's set up. So probably within a month or two, the board will be seeing revisions, which would hopefully be more descriptive of current practice going forward.
Yeah. Why would you not then just bring it to us after those revisions have been made? Why would you bring this to us now before the revisions?
Because we're looking for the ability to talk to providers and get some contracts. There is a recent Detroit news story about Wayne County where the home was closed in Westland because they had no staff. We are looking to add to our network as quickly as possible, and we're looking for some increased flexibility around that right now. So coming to the board asking permission to do an RFP and then bringing it back, it's adding 30 days to an already, a 30, 45 day process.
Yeah, I have some real concerns with this issue. I'm going to have to vote no on it. I'm really concerned with it.
Megan?
Not trying to read your mind at all, but I see the same thing when it says goods and services. If it's just, not trying to make anything more difficult, but if it's just for that, so you can secure those contracts to ensure that nobody is like kicked out of somewhere. Is it possible to amend just that piece of it? So it's not like goods and services, goods could be like office furniture and like other stuff that maybe the board should vote on, or does it have to be all or nothing? I don't know if that's more of a legal question or.
So we have a purchasing policy, which would be provider contracts. So we're going to have two separate policies going forward. This, the way it's written, is we only did RFPs for provider contracts.
Okay.
We would do sealed bids and things like that for things like office furniture or anything like that.
So it
So
does
this is specific.
to contracts.
Right. I
For-
mean, and
okay.
we've issued RFPs before, and gotten crickets as far as a response. This allows us to talk to other providers. We're currently reaching out to the traumatic brain injury, the homes that are certified under that. Yeah. And again, it gives us that flexibility to be more adaptable in these kind of critical times. And it's just removing that one step. Everything else, the contracting policy, they have to meet our contract standards, there'd still be the application. Everything else remains in place.
Donna, I wasn't trying to change your mind or anything, because I know that sounds scary. I just wanted to clarify for myself too.
No.
Thank you.
I mean, I don't mean to step in, but doesn't the current policy also give you the ability to do emergency purchases?
We can do single case agreements, we can do urgent emergent things, yes.
So couldn't you just utilize that to make purchases under that current policy?
Possibly, yes. But this, again, things kind of move slow. So we've been working on these revisions already for a good 3-4 months with the Office of the County Exec, trying to differentiate and clarify the purchasing and procurement policies.
I mean, I would feel more comfortable that utilizing that current language and then bringing us the revisions than completely getting rid of this policy. That would make me more comfortable than getting rid of an entire policy. I would rather that you move forward that way. Getting rid of an entire policy without just doing revisions is too uncomfortable for me. And I know that the rest of the departments in the county utilize procurements. Thank you.
Thank you, Donna. Nick?
Yeah, part of my problem with this proposal is I'm not 100% sure I know what it is. If you read just what you've written, and some of the other questions have indicated the same thing, if you read just what you put on the agenda and the background in the packet, it seems to suggest that we were talking about a moratorium is usually temporary, number
Right.
one. Number two, I can't tell whether we're suspending the entire policy, which deals not just with RFPs, but with the entire contracting process. And so before I'd be willing to vote for something like this, I'd want to see a specific language as to what you're doing.
The board action
Second-
request as written says it's for the approval of a moratorium, which you're right is short-term, as it relates to the requirement for a release for the request for proposal for extending contracts to new vendors. All other tenets of the procurement policy will continue to be enforced when onboarding a new vendor, including the meeting of, discussion with, and majority approval of the procurement committee prior to recommending to the CEO and subsequently coming to the board for consideration and approval. So we're only asking.
I read that, David, but the reality is when I read the actual policy, because this is for the moratorium of procurement policy 3.020 procurement of goods and services. Then it says, as it relates to the requirement for request for proposals. First off, I have a problem with that as well. I mean, theoretically, this would give you the right to enter a contract replacing all of the county employees with a contract. without even doing a request for a proposal, without anybody knowing. Secondly, I suspect that the auditors will have a real serious problem with us never going through an RFP process. Now, what I think I'm hearing you saying is you want to have the right to issue an RFP without the board's approval to issue the RFP, and that from that point on, everything would require.
Yeah, I
board-
misstated that comment. The way it's written here would be that we would be able to identify an appropriate vendor and bring that contract through the board process.
Without an RFP.
Right. There's a
And
limited
in
number
all
of-
occasions. Yeah, quite frankly, I think if I suspect we'll end up with some serious problems with auditors if we don't have a competitive bid process for services somewhere along the line. Secondly, I'd like to see the RFPs, or I'd like to see the methodology for bringing contracts. I generally defer to the administration on recommendations for RFPs or for contracts or for whatever. And I realize the process is somewhat slow because the full board only meets once a month, but you have two other options in front of you. One is you can have a special meeting of the board, and secondly, you can bring requests to the executive committee, which in the time I've served on the executive committee has never met. So there are and there are emergency provisions in this policy. I'm not interested in waiving a policy until I know what's replacing that. I mean, I don't have a problem considering alternatives to that policies or new ways of doing things. But for us, to me, it is an abdication of my fiduciary responsibility to simply say to administration, go in contract with whomever you want, without any board review. Not because you guys are going to do a bad job, because you usually do a pretty good job, but because errors can be made, and that's what this board is for. This is probably the principal function of a board of directors, is to oversee the issue of procurement, whether it's for services or for goods. So I'm very much opposed to this proposal now, and I think there are serious problems with it. I do think we can look at ways to try to streamline the function, considering the employee shortages that are going on, but this is just way too broad from my perspective.
Thank you, Nick. Dana?
Actually, Nick pretty much just said most of what I was going to say, so I think it's probably the lawyer and us would want to see the actual language. And I guess I just would ask, so we would still be approving the contracts. All you're asking us to do is not approve the RFP, is that correct? Okay. I agree, though. I don't know that, I would be concerned about shutting people out that may otherwise not know about the process or may bid on it if we had an RFP. And I do agree that sometimes government tends to be slower than it needs to be, so I'd like to see us maybe make some changes, but I don't know about just totally cutting that out with no safeguards in place to make sure people that may not know about it are still accounted for.
Thank you, Dana. And Linda?
When you read the background, I totally support that there is some need for remedy for the slowness and the situation of staffing and the need to bring new people on. The word moratorium is what threw me off a little bit in not knowing what that entails, and to get rid of the policy completely for what period of time and how. And I don't know if the county has this ability, but when I did contracts for the state of Michigan, we had the ability to do sole source contracts that legally did not require an RFP and an RFQ. So, and I don't know what the procedure for that is and the legalities. I haven't done contracts in a long time. But sole source might be a way to not have that. I just don't, I think it's the law that for public money you have to have an RFP or RFQ. I don't know. unless it's sole source. You're shaking your head, that's not true?
I don't believe so, no.
Okay.
It's not in our contracts.
Are there anyone else that has anything to say? Nick?
Just one quick point to Linda's point, and welcome home. The policy itself lists when you can do sole source and when you have to do a RFP. So if you read the full policy, it's a coordinated program that includes emergency exceptions, as I said before, and I think it's a pretty valid policy. It may need tweaking and updating, and that's fine, but I'm not going to abandon my fiduciary responsibility to watch how the money is spent in this department.
Thank you, Nick. I have a few questions, Dave. Would you be open, a moratorium, when I see this, I understand what everyone has said, and I also understand how cumbersome RFPs are. I got asked for 2 of them in the last month. I sent in a proposal for one because it was only 10 pages long, and the other one I politely declined because it would have taken, probably a week to respond. And the purchasing agent said, why didn't you respond? I said, well, your RFP was 80 pages long. I'm not going to respond to you. And so I understand how tough this is. I'm wondering, would you be open, Dave, to there's no sunset in here. It's an open-ended moratorium, but putting in maybe a couple month kind of sunset, whether 6 months or I don't know how much time do you think you need in this emergency?
This request came from our network operations department as they're trying to accommodate, the flexibility. I'm comfortable going back and saying with the single case agreements, the sole source, or the emergency, that we'll be able to accommodate any of our emergent needs. And then, like I said, this policy is under active review and update right now, so I'd be fine with that.
I'm confused. Does that mean that you're okay without making the change to this moratorium?
Without putting a moratorium on this, I think we can still be flexible enough. Like I said, this was specific to provider contracts using kind of the standard boilerplate contracts we have for outpatient services or residential services. Having to go back, do the RFP when nobody's hardly responding to those was just adding to the, making it more difficult to bring on new residential providers. Like I said, we're actively looking for backups and safety plans and crisis plans and any supports we can get for our system. I do plan to do a mailing, like I said, to all of our TBI homes, reach out to the general adult foster care homes to see if they might have an interest capacity, and then we could look at, it would take resources on our side to bring them up to speed about what it takes to be a certified adult foster care. But we're at that point now where we could be where Wayne County is, where at any minute a provider could say, we don't have any staff right now, and these whatever number of people need to be immediately relocated. So that's the situation we're in, and that's why we're looking for some flexibility, but we could trigger the urgent language in that contract, in the policy, and make it work. So.
Is there any other Linda?
One of the reasons involved in an RFP is that you have your bidders list and you're letting people know who aren't in the mix or, aren't, connected, that we're looking for the service. So you'd still be able to keep your providers list and inform people of stuff that you want to purchase sole source. Is that possible?
It's possible. Like I said, we've done RFP postings and stuff, and it's really tight. So now we're more looking, reaching out to individuals asking them, would you please consider applying under these circumstances and stuff, which kind of negates the need, to do the RFP. We're reaching out to them directly.
And I truly appreciate that we sit up here looking at paper, and the staff who are on the line are in this crisis situation. And, it's not our job to be a real barrier to them being able to help the people who need our help. So that's a problem.
Dave, so in your opinion, you believe under the existing standards, under the emergency, you can operate without a moratorium? Is there ever, a point, that you can't? Would you bring that back up to us then if you ever need another moratorium?
Yeah, I would go, to the executive committee. We would call a special board meeting, whatever it took to.
Okay, because I don't think anybody wants the floor to drop out, but we also,
No, I understand.
like Nick said, we have a fiduciary responsibility, so.
And we are getting good traction on the policy. It's actually on my plate right now to do some additional edits and then bounce it off of on the county side and then bring it back to the board.
Okay. So we have a motion, and I think the motion's going to die, but do we want to maybe rephrase the motion to, I don't know, revisit this in like 6 months, or we don't even need a motion for that, and just let it die, right? Withdraw the motion? Let's withdraw. I don't remember. Yes, Phil.
Quick question. Thanks, Ryan. Dave, are there other CMHs that are doing this? What are the others around the state doing to solve this issue? Or I don't want to use workaround,
but I'm not aware of other. Most our mental health authorities, they're standalone. Their procurement policies probably automatically allow them to be more flexible and adaptable.
Thank you. Thanks, Ryan.
Okay. Who made the motion? I don't remember. Lori, would you like to withdraw the motion?
I support it, so do I have to support the withdrawal?
You support the withdrawal?
Support the withdrawal.
You support the withdrawal, okay. Motion's withdrawn, okay. All right, moving on. Thank you, Dave. Thank you, everyone. Moving on to item 5B, request for approval of Genesee Manor Specialized Licensed Residential Services. Is there a motion to approve? Motion to approve, Linda. Support, Selena. And Dave.
These did go through the RFP process for residential. So Genesee Manor is a residential site, and
yeah, they have sites in Oakland County, and of the 4 people who responded to the residential RFP, they were the best of the group. They do want to come in and take an existing home that we have, so they would be a pretty good fit. And as Dave has evidenced, we do have a lot of needs, so yeah, we're really excited to have someone come out of the most recent RFP review.
Okay, any questions? None? All in favor? Are we ready for a vote then? No questions? None? All right, all in favor signify by saying aye. Aye. All opposed? Motion carries. Item 5C, request for approval to contract with Genetics for primary provider services. I don't think that's genetics, it's Genetics.
good catch.
Yeah.
Move to approve.
Yeah. Motion for Megan, support by Selena. And this is also Dave.
Yeah. Ccbhc is a provider. They started in Wayne County. They are a core provider, so they would be doing the intakes and then case management, therapy services, psychiatric services. They are interested and able to expand into Macomb County. Again, as we're growing and expanding with our CCBHC services and trying to meet the needs of our community, the timing is good. There's also some other factors where we're looking to make sure that people have choice, good choice of providers within our county. So this aligns with that as well. They were, doing well in Wayne County, good reputation, no concerns. So yeah, we're happy to bring them on.
Okay. Thank you, Dave. Any questions? All right, all in favor signify by saying aye. Aye. All opposed? Motion carries. Item 5D, request to approve MDHHS Amendment CMH SP 2022 Community Mental Health Services Program 2022. Is there a motion to approve? Motion by Phil and support by Lori. And this is also Dave.
I like what it's
I said, I know. That's what I was just reading. It's for more money, so yeah, it's easy to approve. Yeah, they amended our contract for added $177,747, it's a lot of sevens, to our CMHSP contract, which is the general fund services. So they are looking to have this signed. We've been getting a lot of emails from the state. So yeah, that's all it is. It's just adding more money to our contract.
Okay. Any questions? All in favor signify by saying aye. Aye. All opposed? Motion carries. Item 5F, request to approve the special assessment in the amount of $34,000. But did I forget E? 5E, request to approve to rate increase. Hold on, let me start over again. Request to approve to provide a rate increase for contracted hospital providers. Okay, there we go.
All right. We've been meeting regularly with finance, and again, looking at our rates, and you've heard from some of the residential providers and stuff about the rate differential between Macomb County and some of our neighboring regions and counties. We were incredibly low on the hospital per diems when I started. We have done some previous per diem increases. We are recommending a $50 across the board per diem increase for our community psychiatric hospital partners. It brings everybody up to right around $700 per diem, which is closer to being at par. Does not put us in the middle of the pack or the top of the pack, but it's closer. And again, you know, our hospital partners are struggling as well with the COVID impact, the staff shortages and everything else. So we do support this. It equates to, I believe, 2 million. Residence Hospital. Yeah, it's about $2 million on an annual basis.
Okay, any questions? Selena?
I will be abstaining from this since it affects my employer.
Okay. Any other questions? Comments? Dave, I guess I do just have one quick question is how did you come about or how did we come about the $50? Is that just a starting point? Are we going to?
We talked to some of our hospital partners and again, we were able to do a rather easy rate comparison to the other regions around the state. Like I said, we were low, so we considered the financial impact of a 25 and then a 50. We were going to look at maybe doing a stepwise increase, you know, do a $25 now, maybe 6 months later do another one. But given our financial situation, the needs of our community, we thought it best just to do the full $50 per diem now, and then we'll keep an eye on it and track it going forward.
Okay, thank you. All right, all in favor? Any other questions? Nick?
Just real quick, if I remember right from our earlier discussions, this won't require a budget amendment or within the budget?
No, not at all. Yeah, we have lots of money and contracted services.
Okay, all in favor signify by saying aye.
Aye.
All opposed? Motion carries with Selena, of course, abstaining. Item 5F, request to approve the special assessment in the amount of $34,517.00.
Move to
to approve.
I did not catch that. Oh, you got it. All right, we have a motion and a second. And Dave, do you have anything to say about this?
No. I've shared a lot of information on this. I have been part of the Community Mental Health Association's planning meetings for how to use the special assessment funds. It's part of my CEO report. I did meet with Gina Joseph, reporter for the Macomb Daily. That was organized through the special assessment. It's Lambert and Company is the marketing PR firm that the association is using. So we're already kind of benefiting from that approach. And like I said, we did learn that apparently on average people are contributing the CMH SP fees and the CMH SP dues and the PIHP fees. So for us, it's that $34,517.
I have a question about the Gina Joseph. That's great. I look forward to the interview.
Yeah, it was on 128. The article has not come out yet.
Okay.
She also spoke to Pat Haver, who's from our CAC.
Please let us know when the article comes
I
out.
will.
Any other questions or comments? None? All in favor signify by saying aye. Aye. All opposed? Motion carries. Item 5G, request to approve Genoa telepsychiatry contract. Tracy, or is there a motion? Support, motion by Antoinette and support by Mark, by Donna. I didn't hear. Hi, Tracy.
Hi. So as it states in there, I'm sure you guys already know this, but there's a shortage, more specifically a shortage of child board certified psychiatrists. So we already had a shortage, then the pandemic happened, and guess what? They all can go wherever they want, whenever they want, however they want, right? So before you today is one of 7 agreements that will be coming to you for review. The other 6 are in some type of legal process review. So basically, we had a long list of providers. I reached out to all of them. They weren't our current providers. They were just a long list over the last 2 years. People have said, hey, I'm interested. I said, we have a need, and they've presented this. The ranges are anywhere from $200 an hour to $250 an hour. There were other ones that were above that, and we're only selecting or looking at the ones that are within that range. That is up to $55 more an hour than we're currently paying. But we've discovered even at $250, that's still not on the high end, but we had to at least jump up to be a little bit more competitive. So this one is just for this one particular agreement, but you'll see 6 others. 3 of the ones are ones that we already have agreements with. They will just be updated with the new rate within the range that I just mentioned.
Great. Thank you, Tracy. Any questions? Donna?
Yeah, I read the contract. It looked like most of it was telepsychiatry, but it did have some provisions in there for them to be face-to-face. Is that correct?
Yep, when we put it out there, imagine we put like a profile and we said, we really want somebody who can come on site. But these days, that's a tough one to find. So our request is we prefer to be on site or at least partial on site, but then we kind of hedge our bets is to say of what we can get. That's why we want to get these 7 providers and say, who can do it? Who can provide us somebody who can meet the needs that we're looking for?
Where is this particular?
Genoa is actually, it's the same Genoa, different division of the pharmaceutical company, if you're familiar with them. I apologize, I don't remember which state they're based in.
I mean, so these psychiatrists aren't in
everywhere.
Michigan.
No, not necessarily. We currently have psychiatrists throughout the United States already. We already do telepsychiatry. If we do not do that, we cannot provide the services that are needed.
So you could get a psychiatrist if you needed one to come face-to-face for a consumer if you needed one.
That is our constant battle, and if we need that, that's what we do. We do have on-site psychiatrists. But it's getting more difficult because imagine the psychiatrist, wherever they live, whether they live down the street here or whether they live in Hawaii, right? They can pick and choose, and they're enjoying the telepsychiatry option also by staying home. And
How are the consumers reacting to the telepsychiatry?
I wouldn't be able to speak on a exact, because every consumer is obviously very, very different. There are some that seem to be very comfortable with it, but then there's some, of course, that aren't comfortable with it, and we do have that option when those are applicable to meet on site.
Okay, thank you.
It's a tough battle, though, too, and there's actually consumers, too, who have become more comfortable with not coming in, which is a bad thing, too, right? Because you do lose,
Oh, I would think you would lose a lot.
for sure.
Any other questions? All right, all in favor of approval, vote to signify by saying aye.
Aye.
Aye. All opposed? Motion carries. Thank you, Tracy. And item 5H, request to approve printing budget. Is there a motion to approve?
So moved.
A motion by Megan and support by Selena. And Kathleen and Dave are going to talk on this one.
Hello, everyone.
Hello.
So we're seeing that we had quite a lot of print materials that we needed to publish in the coming months as events start to increase. We went and talked to 3 different printers. I had one printer that wouldn't even work with us to give us any type of sample and to show their worth because I wouldn't give them a credit card. So they were asked, everybody wants to be paid up front and they're doing it all online. But there were 2 printers who we reached out and we did some work with. And the first one didn't perform as expected, very disappointing, and there certainly wasn't any customer service. And then the price wasn't all that great. So I feel like I was very fortunate in finding a printer that not only quoted us a price that was about 30% less than the competitors, but also provides customer service and additional support. So I have them currently, they're completing a couple print jobs right now, but I'd like to keep them busy because we have a great need for a lot more literature. And so I can see that quickly exceeding the amount of money that I can spend without approval. So I'm asking for your approval to continue working with them at least through the end of the fiscal year. Some money's appropriated for them, and we'll go back and review what their work is like after that.
All right, Linda.
With some work I do with the library, I use a printing company across the street. So was there an attempt to do local companies?
Yes.
Okay.
We did reach out to a couple of different companies, and they, said, sure, we'll quote you, and then they never got back to me. So I finally got 3 people to actually give me quotes, and then went from there and gave 2 of them the work.
Thanks.
Any other questions? Dana.
I guess I'm just kind of wondering how the process works, because the same thing, I can think of 2 printers I know offhand that do a decent job. I can't believe they would charge you $50,000. So I'm just wondering, like, how you reach out to people, how all that works.
Well, the $50,000 amount is the ceiling where I think we would go with spending, because as I'm talking more to our different groups within CMH and determining the needs, currently we're updating literature that we have existing, but we have more services that we're offering. So I anticipate that the 12 rack cards that I'm currently working on will quickly become 24 and possibly 30 in the coming months. And then we're looking at other areas like where posters would be helpful and other types of outreach. So I probably won't spend the entire 50, but then I never know.
And so, so what do you do? Like, just pick some companies and call them, and they say we're interested, we're not? Because I'm assuming this is Oakland County, right? The company you're.
Yes, it is.
Okay. So nobody in Macomb County wanted to work with you, or?
Well, I reached out to a Macomb County printer, and they basically said, well, it's funny, a number of these companies, including the company that Macomb County uses, are in Wayne County.
Mm-hmm.
And the company that I've been working with, even though their office, their satellite is in Oakland County, it went out to Plymouth. It seems like all the printing is happening out in Plymouth for some reason. But
and do you feel like you need like a bigger company because this is going to be a larger job, or?
I'm really more concerned about the quality And as a designer, I'm a great writer. I mean, I have a passing experience, and perhaps I'm a little overconfident in my abilities in Adobe InDesign. And what I was looking for was not only somebody who could provide quality printing, but somebody who, wasn't hesitant to pick up the phone and call and say, I think this could be a little better, and I'll tweak this for you if you don't mind. And who wasn't necessarily going to upcharge for doing that. And that is what I found with this particular printer.
Okay.
They saved me from myself quite a bit.
Right.
So
That explains a lot. I appreciate that.
Thank you.
Any other questions or comments? All right, all in favor signify by saying aye. Aye. All opposed? Motion carries. Thank you, Kathleen.
I'm sticking around because I'm
Oh,
the
yeah,
last
that's
one.
right. There's a 5I, a motion, is there a motion to request to approve the media campaign budget? Antoinette, a motion by Antoinette, support by Linda and Kathleen.
Okay, well, I want to tell all of you, I started in nonprofits 30 years ago, and so just the simple fact that as a nonprofit entity we have to spend money just grinds me. There used to be a day where you could get public service announcements on the radio and television, and the newspapers would give you some print. And the amazing, sad thing, it's a mixed blessing right now what we have going on. There are so many more channels, so many more avenues, but there's so many more competing for the dollars. And you would think they would give us price breaks, but no, the prices seem to increase, and they tell you, well, we're giving you a niche. We can find your targeted audience. And they have different ways that they quantify it, and we have to trust it as much as you can trust anybody who buys ink by the barrel, isn't the old saying? But I've spent several months and had quite a few conversations with people in several different areas. I've talked to people with internet streaming. I talked to people in radio. The four largest radio conglomerates, I'm sorry, they're all conglomerates anymore. There are very few people broadcasting out of a small little booth, sad to say, but spoke with 4 of them, and then spoke with the 2 papers that seemed to get read the most in the area. And we looked at billboards as well, because I think we need a nice mix. Because there are so many different segments we need to reach, we have to try a number of different avenues. When was the last time you read a newspaper?
This morning.
Right, but if you talk to a teenager, you talk to the newspaper, what? That's what we wrap things in when we're getting ready to move. So there are so many different audiences out there. And last year, prior to my coming on board, we tried a radio campaign, and we have done some television. But I think we need to try a number of things and throw it all against the wall and see what sticks. The sad thing is it's a challenge to quantify it, but I think the best measure is, are the phones ringing? Are people seeking out our services? So I can offer no crystal ball. This will be what works, guaranteed. But I think these are several good paths that we can take. So that's why I'm coming here. I sat here quietly for how many months? I was going to come out here eventually and ask you for some money, right? So I have more detail if anyone would like to see some records of the conversations I've had in the spreadsheets. I have no problem sharing that. And I have a little piece here that just gives you some idea of the reach. We have the conversations and they talk about the reach, and then I realize I can't find that note that they gave me, but some of them do provide some. So I have this to share, and also of the billboard locations. So I brought a couple along if anybody would like, even though you have to vote on it right now, right? I still have them to share. So any questions? Probably should let you take a look at it first.
Thank you.
Oh, this is a bigger thing. I don't know how to count. They must be in my folder.
I'll share mine.
I have more. Sorry. I did have them.
13 mile cross, 13 mile, 12 mile, 12 mile.
Through the chair, we're also, the community needs assessment will help inform us about where we're possibly have gaps in our communication. So we are putting a lot of focus and effort on getting the message out in as many different formats as possible. So as Kathleen said, right now it's broader, but we do hope to dial it in and to be able to track the responses with greater detail going forward.
Nick?
Yeah, I think it's very important that we do this. I think I've heard David tell us several times that one of the problems we have is penetration. That is, people don't know that necessarily know we're here or how to contact us. So it's very important that we do this sort of outreach, especially considering the fact that we have a number of novel and new programs that reach totally different populations, like the CCBhc program that can provide services to a lot of people. And with all of the additional, I've been surprised that we haven't been flooded more with requests for services in light of the pandemic, and knowing that that has an effect on people just naturally. You didn't take a rocket science to figure out that would come, and surprised that they aren't finding us. So I'm really pleased with this. I don't know if this question's for you or for David. You did mention that it's hard. It's going to be difficult to figure out which component you try actually works. Can we do anything to when people come in to find out? Just simply ask, how did you hear about us? And then be able to have some feedback as to which are the most effective communication tools. Do we do that? Can we do that? Should we do that?
You know, I think that's something we certainly, it would be a little off-putting to do that when they first came in, but I agree. And I have talked to, the customer service manager to see if there might be some way. And also I plan on talking with our managed care operations to see, do you hear anyone, not that you need to ask any leading questions, but if somebody mentions that, could you note that somehow and let us know? Anecdotal at best, but it gives us some insight. And I didn't mean to say that we don't have any type of measure. Some of these venues do offer some type of analytics. I mean,
Yep.
we all know we get tracked everywhere we go, right? So we will get some type of insight there as well.
Probably the best place to do that is in the satisfaction surveys that we do. I agree, you don't want to have somebody come in the door and say, how did you know to come in the door? It sounds pretty, it kind of defeats the purpose. But as we're exploring, as we're looking at the satisfaction, which we are regularly surveying, might be a good point at which we could say, what led you to the service?
How did you hear about us? I mean, it
Yeah.
is something that comes up in a conversation.
Yeah.
And we have some very astute people who interact with
Yeah.
the people we serve. So I think we could get, whether we'd have, an effective, graph or anything, but I think we could get some great anecdotal insight there. Definitely.
Question, Kathleen. I notice on the billboard placements, it looks pretty spread out, but is there, it's really important, echoing what Nick had to say, that, we provide not just, rifling in on certain populations, that it's a bird shot. We hit every possible person out there that needs services, regardless of where they live in the county, from East Point to Ray Township, from Chesterfield to Sterling Heights. I mean, just everyone knows about us. And is there any way we could even, are there more billboards that we can purchase or to rent out to get even a broader range?
They've been a little hard to ferret out, those companies, to be honest. And to be truthful, the best way to sometimes get a response is to purchase something from their competitor. I can't tell you the number of times that somebody says, hey, you're advertising with somebody, why aren't you advertising with me? Well, I didn't know about you. Are you going to give me a better deal than they are?
Right.
And which is not bad, because somebody always wants to beat somebody else's price. To be honest, this is a starting point. These are the vendors some of these vendors are people we have worked with before. Some of them are people who had been knocking on our door, and some of them are people that I've had great experiences with in past lives, to be honest. And so I said, what can you do? What do you have to offer? And I'm hoping that, I look at this as the first phase. This is something I'd like to do in the spring going into summer, maybe lay low in the summer, get some feedback, see who else brings their offers to the table, and then we'll put together maybe a totally different approach in the fall, going into the winter months. I'm hoping to ferret out some other great resources that we are unaware of right now. That's a great question, thank you.
So you would be able to find more billboards throughout the county, you think so? It's just a starting point?
Yes.
Okay.
It's just a starting point. I had a conversation with another group, but it was an electronic sign, and it was on a highway. And I don't want somebody getting in an accident trying to get our number, or
Sure.
staying on the highway because it's not staying up. So I'm hoping we'll find more vendors. Once we get out there, trust me, they find us. We start a campaign, I'm going to hear from quite a few other people. As a matter of fact, she wasn't able to get any numbers to me in time, but shopping malls, how much traffic do we have in shopping malls anymore? I don't know, but if the rates are low enough, that might be an interesting place to do something. Certainly not Partridge Creek in January, but maybe come June, that might be an option we want to consider. So.
Okay. Any other questions? Antoinette?
I like the breakdown that you have here. Having a background in advertising and marketing, I think that this is a really good start. And you answered one of my questions when you said that you would take a look at it again, towards the summer and see kind of where you are. I think that's really important. I love how you've added, you say possible TikTok spots. I think you should definitely do TikTok. I happen to be a little TikTok famous, guys. Not really, do not look me up, please. But I think it's really important. The Google ads have been huge, so definitely that would be something that you would want to hit pretty hard.
It's frustrating to not get started, to be honest.
Yeah.
I didn't hear what you said, Kathleen.
I'm sorry, it's been frustrating to not get that started, to
Yeah,
be quite
yeah,
honest. I mean,
Google
that's another
Ads.
one that, you've got to have a credit card to do it.
Yeah, yeah,
I thought about
that's-
pulling out my personal one, but my husband didn't like that idea, so.
Right. So, but yeah, just the, for even the TikTok, Google ads, things like that, where you can see at least the people that are clicking, you will be able to see where they're at. So that's very important because then you can see where you need to specialize at a little more or broaden that perspective. But the billboard placements, I think that's really good as well. When first the malls are empty nowadays, so not too many kids are there, but they're so busy, like on their phones or iPads or whatever. The streaming and the Instagrams and TikToks, I think for a younger audience, you would be wise to stick with that. So I really like how that's in your plan here, and it's just a way for people to, especially the younger generation, to reach out. Because sometimes they don't know who to talk to. Right. Like I did the self-care. I, was pretty open saying this is what helped me, but I got like 50, 20 and under people following me. Now all they see is real estate, unfortunately. Sorry, but just for them to say this helped me, I think it's really important, and I think that this is a good avenue to go. So it's my 2 cents.
Phil?
Thanks, Ryan. I mean, I would pay $100,000 just to see Dave in a TikTok, so I'm excited for that. Let's do that right away.
Oh, come on, the nurses have been getting beat up for those TikToks. We don't want to do that.
The new procurement policy says I have veto abilities.
Quick question though, for the $100,000, you started with that, and then there's the split. How did you come up with $92,000 for the billboards and the radio and stuff, and then the internet stuff is only about $8,000? I would like to tip the scales a little bit more the other way, but I know the others.
Understandable.
The other media is more expensive.
No, exactly, and that's it. Traditional is, and it's worth. to be honest, in one of my notes, I said, some of these papers, they've been good to us. It might be nice to be good to them because they are struggling. I mean, the Macomb Daily, anytime we've come to them, when we did the walk-in visits a few weeks ago, the Macomb Daily and the C&G papers quickly put that in there and basically ran our press releases verbatim. So you take care of those who take care of you. And it's not that I think that Dave did a bad interview and then we need to give him the money so that, balance it in our favor. I know he does fantastic. But the point of entry right now for the internet advertising is lower. The sad thing is, though, I have a feeling once we get started in something like Google Ads, because this is my past experience, once you start using keywords, you drive up the cost of keywords. And so, a year from now, we probably will have to invert that, Phil, simply because those are the people with the technology, and they can gauge it, and they can see if they can, get more money from you. They can, and they can change that a lot quicker than the newspapers can change their rate cards. So I just thought, as a starting point, we'll give them all a chance, and we'll see. I didn't even propose any traditional TV because I just don't see how they can, ask that. We tried during WDIV had a mental health hour back in October. We were the only community health that participated. And it was basically a commercial for some private providers and for the people over at Detroit Wayne. So trust me, our Channel 4 rep knows that wasn't too happy about that, and I want to talk to her assignment desk people before I want to talk to her advertising people before we move anything forward. So, but still we have to, give it a try. Give traditional media an opportunity and see. And a year from now, the rates will flip-flop too, the way things are going.
No, it's a great starting point. It's very encompassing. So thank you for putting this together. And yeah, we will look at it again in a year or so, or whenever it may be.
Maybe in
and
the fall.
the scales may be tipped, but it's a great starting point. Thank you. Thank you, Mr. Chair.
All right, Donna, did you have a comment? No, I thought I saw a hand. Okay. All right, well, I don't think there's any other comments. Thank you, Kathleen. All in favor signify by saying aye. Aye. All opposed? Motion carries. And now item 5J, back to Tracy. It's a request to approve the Sugar Bush lease. Sugar Bush lease.
You'll notice this was unusual in the way that it's for 18 months. It is at a larger rate. You will notice trends. We are having harder times negotiating for obvious reasons with landlords and getting lower rates like we used to get a couple of years ago. This is still competitive, though. It's still on the lower side, even considering those increases. Part of the increase is due to the taxes going up and the insurance also going up. So that increase is not just solely due to the base rate change. We are purposely doing 18 months. I'm sure you guys know the real estate market is dramatically changing these days, including Dave and I have taken advantage of that personally. So if you haven't done that, I highly suggest checking it out. Anyway, I say that to say that it's in flux for lots of reasons. So we're trying to be conservative in the way that we're not signing 5-year leases automatically. We're literally negotiating, and we're trying to kind of let the market play out a little bit. We're also noticing, if you don't know this, there's a large number of providers that are leaving our homes. So that's another reason why we don't want to sign a bunch of 5-year leases, because at a regular pace, providers are leaving the homes and leaving them empty. So we're trying to reduce, we're most likely going to start exploring a maximum of 2-year leases with future ones that you might see. In 2022, we have about 40 homes coming up for renewal. So you will this is the first, you will begin to see lots of them with the disclaimers, all the disclaimers that I just mentioned. And all the repairs that were needed on this home. It's a good relationship with the landlord. They were taken care of promptly.
I'll make a motion to approve.
Motion to approve. There was no motion?
Uh-oh.
Thank you. All right, there is now. Thank you, Phil. Motion by Phil, support by Antoinette.
Do I need to repeat myself?
No. I have one question. Is there anyone else that has questions? With all the, Nick, go on.
No, you go ahead.
I know we're having trouble, losing our providers. Are we having any trouble losing, I know some of our individuals we serve are losing their homes, but that's not because of the landlords. That's only because of the providers. Is that true?
Correct. Over the last couple of years, there have been a couple landlords, maybe they are older and don't want the home, but we've surprisingly not had, considering the market, a large number of landlords, get out. But we're a pretty consistent provider, or payer,
Right.
And safe, and we take care of the home, so it's still a pretty good business model for most landlords.
Okay. Thank you, Tracy. Nick?
Yeah, I am a little concerned about the large increase, the 12% increase, although with the reductions, I'm not surprised there isn't any. But I would hope that we not get taken advantage of. I think the reason you don't lose landlords is because they make a lot of money on these leases. But my question deals more with TJ's report on the special notes where the provider did a number of repairs in violation of our contract with the landlord to get approval of it. And I suspect, I don't want to be too critical because they all sound like good things to do for the consumers, and I suspect the landlord may well have approved, but what do we do to make sure that our providers, or what will we do with this particular provider? Do we have this problem with this provider at other sites, or to make them known, to make them aware of the requirements, that certain things require landlords sign off, so that we don't get into this type of a situation? It's the first time I've seen these kinds of special notes on a report from TJ.
It does happen. So unfortunately, we advise them, because we do advise them on a regular basis, that all repairs have to be approved by the landlord and an
Except
agreement up to
painting.
spec. Yeah, right, because what if they wanted, I'm being simplifying, of course, but they wanted blue paint versus
Yeah.
whatever the specs are. So it does happen. When it does happen, we do what we did in this situation, which is provider, unfortunately, will work with the landlord and see what options there are, but you have now placed, let's say you spent $10,000 on this, unfortunately, you have placed that at risk because you have to get landlord approval. And in the agreement, the lease agreement, you'll see that any repairs, we have to get agreement with the
So
landlord.
when this ends someday, and we have to revert to this old system, or the old state of the home, who's liable?
In that case, it would be the provider. But in between now and then, let's say the provider changes, because that does happen, we have a closeout with every provider, and we try to hold them accountable for those repairs or bringing it back up to spec. But it is a challenge, just so you know, because often when the provider's leaving, they're leaving because they can't financially sustain themselves.
And I know you're doing a lot with contract compliance issues. Does our contract with the provider, I'm trying to remember, I've seen the boilerplate, but it's a long contract. I don't remember all the details. Deal with violations of this
It talks
nature?
about expectations and repairs. So there's a section in there, and the easiest way to look at it is there's a one-page seasonal checklist, and imagine it talks about all the things they're responsible for, including proving they did it. For example, every year they have to prove that they have an invoice for snow removal, for fertilization, for landscaping, that type of thing. But it is a constant battle, right? Like they have to prove it. So we do desk audits, TJ does, for those types of things. And then, of course, they do on-site reviews to make sure they're maintaining it.
But in terms of, in this case, the violation was not of our contract with the provider for what they were responsible for, but the provider's failure to notify the landlord of updates that they intended to do. Remodeling a bathroom is not a bad thing, but had they notified the landlord, we wouldn't be in this sort of situation. Does our contract with the provider cover, require them, or contractually require them to comply with the terms of our lease?
I believe so, but Nick, I don't want to misspeak. I would also have to go back to the
Yeah,
provider
okay.
contract
Fair
and reference exactly what it says.
Okay, fair
Yeah,
enough. Thanks.
but there are out, if that makes sense. Unfortunately for that particular provider, it creates a bad situation for all parties involved, because if the landlord's not satisfied with the work even, it could be amazing work, but if he doesn't,
Yeah.
is not satisfied with it, even if it was a $100,000 bathroom, he could still say,
Yeah, pull it out. If you didn't get prior
Yep.
approval. And that's why you do the prior approval. I understand that. I understand the provision
yeah.
in the lease. What I'm trying to figure out is how we can enforce our requirements as, under the lease, on the provider, that they don't violate our lease. And so if you could double check that and see if there's recourse there. The question you didn't get to was my one as to whether or not this provider is one that has regularly created this problem at other sites.
I'm not aware. I'll
You don't-
validate with TJ, but I'm not aware of that at regular occurrence. It's unusual. I'm sure you can imagine that somebody's going to spend a large amount of money
Yeah.
just to spend,
Yeah.
right?
they don't
Good
like-
motives, but it's
Yeah.
very unusual.
Okay, thank you.
All right, any other questions or comments? Thank you, Nick. All in favor signify by saying aye. Aye. All opposed? Motion carries. Thank you, Tracy. Item 5K, request for approval to provide a rate increase for all specialized residential providers. Is there a motion? Motion by Donna and support by Selena. And this is Dave.
Yeah. So you're sensing a theme here. I mentioned at our last meeting that we were looking at a across-the-board rate increase for all non-hospital providers, with a special consideration for the residential sites. We did reach out to some of our providers, and they were able to share some comparison data with us. Again, we've been meeting on a regular basis. Adam and I meet with Christina and Richard and Ken from finance, and we've been having these discussions. What we're proposing now for the residential providers, and it's important to note, all of these changes will have clear language that ties this increase to the federal state of emergency that's stated, and it would go 6 months. It would end, could end 6 months after the state of emergency was ended. We're doing that for two reasons. One, it aligns us with the expected funding reduction that we would experience when that state of emergency ends. And it also would just kind of clarify what the provider's rate up front, so we wouldn't have, any influx of, or cascade or avalanche of inquiries, the state of emergency ended, what's going to happen? So we just want to make that clear up front. Again, the state of emergency means they're not disenrolling Medicaid eligible people. Our Medicaid capitation is tied to Medicaid eligibles, so our revenue is high. When that stops, we will see the corresponding revenue reduction. So we did the $50 hospital per diem is what we're requesting. On the residential side, we're asking for a 10%, which would be about $2.6 million for the remainder of this fiscal year. It's about $4.4 million on a total for the entire fiscal year. And yeah, it gets us closer. I can honestly say well, when we look at the statewide data, we're doing well when you compare us to the statewide averages for these services. And this definitely helps get us an appropriate level. And again, our residential providers are the ones who are struggling the most to meet the needs of people in their care. We do also, Tracy mentioned the increased rates for the psychiatrist. So I do expect I'll be bringing to the board, they're called the Evaluation and Management Codes, the E&M codes that are used by psychiatrists. We are looking for a specific rate increase in addition to this across the board. I would like to discuss with the board. Given all of these changes and stuff, we did not get the board action request. So it's up to the board's preferences. But there's also, in addition to the residential 10%, the hospital $50, the psychiatrist rates I'm going to have to hold off on. But we could do an 8.62% across the board, which would be from March through the end of the fiscal year, for all other services. So it would be the non-hospital, non-residential codes. We could do the 8.62% across the board with the board approval at the full board meeting. Again, that's up to your preference how you'd like to do that. We had projected about a $10 million annualized cost, but that included the residential. So it's going to be less than 10 million. Again, there is no budget adjustments. This is all under contracted services. So the board action you have is for the specialized residential providers at the 10%. And then at the board's discretion, we could do the additional 8.62%, start that in March and get that approved at the full board. But that's, we can do a, whatever, executive committee or another thing to get that on for the full board. And I'm happy to provide the additional detail and answer any questions ahead of the full board meeting later this month.
Okay, thank you, Dave. Nick?
We've got the piece on the residential before us in the background, so I prefer we deal with that. In terms of the other, I don't, maybe somebody else does, or the chair does. I don't have a problem if you were to put that on the full board's meeting and then we get the background information. We don't have to make a recommendation on it.
Thank you.
Here, the full board could simply consider it. I wouldn't have a problem with doing that. But I would like to see the background that you provide us before we actually take action.
Thank you, Nick. Does anyone else have any other comments on that? Just a quick question, David. You said that the 10% makes us, we're competitive statewide, but I don't know, do we compete statewide? Isn't it, what about Metro Detroit, just our nearest neighbors? Where do we stand? I agree with the 10%. It's a great start, but does that get us where we need to be?
Some other regions and counties are getting creative and are doing a lot. They're putting a lot into those rates, and it does skew it.
Okay.
So some of our neighbors are much, much higher. The rumor, unsubstantiated, they're doing some additional of those recognition payments. I think Wayne County already did a $2,000 out to their provider system. Over and above, that's not the direct care wage. That was across the board for everybody. And some of our other neighboring regions are doing that, which again will impact us and might actually pull some much needed staff from us. So we can work within our rates, and that's what we're trying to do as much as possible.
Okay, and the second question, and then Megan, is calling you, and that is the 8.6. What's the? I'm a little confused. What's the basis for 8.6?
The 8.62 was the 5% annualized across the board.
That's right. Okay.
It's just if we would have started it this month, it would have been 7.5. If you start in March, it's 8.62.
Got it. Okay. Megan?
Excuse me. So I'm like definitely supportive of supporting the staff that's already out there doing the job and that's been doing it. 1000% totally get that. But I guess like HR perspective, just thinking about like thinking towards the future, is there any way, and maybe this is something that needs to be researched, I'm not even tying it to this, but is there something like, you know, so we can get it to full board, but is there a way that we can look towards maybe like training programs to bring new people in and maybe putting some money towards that? Because I totally agree that it's important to appreciate the people that are currently in it. But also, I mean, I'm sure, I know we've had a lot of situations where you have people who've been doing a job, not just through the pandemic, but much, you know, prior to that, who are like, this is no longer for me. I want to completely, hi, HR right now through COVID. You want to just completely transition a career path. So I'm sure that we'll just have normal attrition, retirement, things like that, and people wanting to leave the field. So I think it would be interesting. I know you need one more thing to be put on you, but I think that putting some money towards that. I actually looked on I think it was the Macomb County website, that they're doing a bunch of training programs where you, it's for a certain like economic level. You can get a grant, I guess you could say, to do those programs like certified nurses assistant, things like that. So I mean, I wonder if we could get crafty and do something like that so we have incoming people into the field as well.
We actually had those conversations with Macomb Community College, and the recommendation was that we also then go as far back as middle school and starting,
Sure.
the messaging about making a career out of working in community mental health. I saw one of our providers' videos today about, you know, the personal benefits of working, you know, it was Easter seals, and they were had nice videos about be the change.
Yes.
And the impact you have on people's lives and stuff. And I think that's a really strong, powerful message. So yes, we have been working at the state level, multiple meetings about the staffing crisis and how to, start that pipeline, get anything we can do to retain and recruit.
And encourage, sure.
Yeah, people into our system. So yes, those are very good points. And we will be as creative as we can be.
All right. Thank you, Megan. Donna?
You know, Lori and I attended the winter conference today, and when we got here, we were just so excited about one of the conferences that we attended. So I just have to tell you about it. It was about a training program for direct care workers. When we got here, we were just like, oh my God, it was so awesome. I mean, it was like the most awesome workshop and what they're doing for training for direct care workers. And we were just talking about it. And what's the name of it? Impact?
One is in
I'll move over
Compass,
to Lori.
Michigan. One is Impart Alliance. That sound familiar?
Dave probably knows about it.
Area of
I'll pull up the
agencies on aging also, because a lot of us call it. And there were 3 of them, and this was the whole discussion. And they're definitely doing a lot of work right now. In fact, I even took a picture of the last slide so I knew what websites to go to. Because they're doing, this was a huge discussion at the conference this year, or today, the one that Don and I happened to go on. And so, yes, there are things being done, there are things being pushed, so.
Awesome. Really, really awesome. Probably one of the most awesome workshops I have ever, and believe me, I'm a social worker and I worked for CMH. You know how many workshops I've attended? Millions. It was probably one of.
By certain counties?
Pardon?
Remember the counties that are using the?
They were in every county, but they had specific counties that they've been utilizing for, I think, 11 different counties that they were utilizing. But you can go on there and you can look at their programs. I think they'll have them up there till March, but It was such an, I mean, sometimes you're bored in a workshop, but believe me, it was far from boring. I was really excited in it. And what they're.
Dave was on the panel, so I wasn't bored.
Yeah, that was a very exciting one. This one, believe it or not, was even more
Of course,
exciting.
that was the best that the
Yeah.
conference had to offer.
Yeah. This one was very exciting too. But,
They were a close second.
Yeah. It was a close second, yes. But it was just awesome what they're doing and what they're offering. So I was very excited about it, and it was really awesome, some of the programs they're putting in place. A credentialing program with 3 different layers of credentialing that they're putting in place, and just really, really, all of the things that we would dream of that you could put into place for direct care workers. So I would suggest that anybody that can access, go on there and look at it. And it was really awesome. And I was really excited to see Lori was on there too. So both of us were really excited. When we got here today, we were really excited to talk about it. Thank you.
Thank you, Donna. Nick?
Yeah, just along Megan's line, one of the things this does is give some dollars to providers who are the employers of the direct care workers. We don't employ them directly, so, and one of the things a lot of providers are now looking at in order to retain staff is providing a career path, which means they're talking about reimbursement for training to become an RCA, training to become a licensed practical nurse, et cetera, et cetera. Because one of the problems we have is attracting people, obviously, to direct care work. It's a tough job, it doesn't pay well, and we're trying to address some of that, but also the fact that there's no real career path. They're in the process of trying, providers are in the process of trying to create a career path. So I think this, this doesn't guarantee it, but this will help facilitate that effort.
Thank you, Nick. Thank you, Donna. Thank you, everyone. All in favor signify by saying aye. Aye. All opposed? Motion carries. And Nick, would you like to make a motion to move is it the 8.6 to the next meeting, or do we need that motion, or are you all set, Dave?
Well, my suggestion is, it's up to the chair of the full committee. If you put it on the full committee chair and the chair agrees and we get the packet, I don't have a problem with bypassing this committee unless the chair of this committee objects.
Just, we have that process of always moving something through program and budget. I like following processes, but
Every once in a while, we put.
Phil.
A number of us have objected to adding things to the agenda at the last minute because we don't get the background information.
Right.
And so I prefer we not add it to this agenda, but if you add it to the full board agenda and we get the background information, unless somebody else objects, I'm not going to object to dealing with it there.
Sounds good to me.
I was just gonna have it added on as a new item, and whenever Dave sends us the background stuff in the next week or so, we'll have all that. I've already told Sandy, or asked Sandy to put it on there.
You've already done it? Wow. We are efficient here. I love it. All right. All right. Item number 6, receive and file. Is there anything to receive and file? No. Item number 7, we have a resolution. And Tracy is, looks like Tracy's coming up. A motion to, move to approve, and
Support.
Megan made the motion and Linda made the support.
Steve Smith. We're very sad he's leaving, obviously. I do not recall, forgive me, the total number of years it's going to be in there, but I want to say it's around 30 years. He was a program supervisor and has been with the organization for an extended period of time. I'm sure Donna can speak to his tenure also. He was a program supervisor over the VDPS and OBRA programs, if you're familiar with those. Just to remind you, VDPS is for the IDD population, or the intellectually developmentally delayed population, and also OBRA is for individuals who are in nursing homes and need, and I'm very much simplifying it, and need assessments. We actually physically go into the nursing homes and make sure those individuals have the proper assessments completed. We did have a virtual party for him last Thursday. It went very well, was very well attended, and he was happy. His family actually was also able to attend, and of course, his staff did a fabulous job on getting him a gift. If you didn't notice it, he was in the last week's workforce update with his picture and inviting everybody to his virtual party.
Thank you, Tracy. All right, we have a motion and we have support. All in favor signify by saying aye. Aye. Motion carries. Other possible agenda items. CEO update.
Well, a lot of my stuff has already been touched on, which is good. I was going to speak about the Senate Bills 597 and 598 again. As indicated, the association is very active in this area. I would like to thank Commissioners Wallace and Kraft for drafting a resolution opposing Senate Bills 597 and 598. I was at their committee yesterday, and that'll be going to the full board of the commissioners for final approval. I counted as I sat in the audience. I believe there's 20 other boards of commissioners that have formally opposed. So now we will be well represented on the community mental health's information that goes out opposing that. For the winter conference, I just wanted to thank Ann Pacheco from, she's our program coordinator for our CCBHC, and she was a panel discussion on the CCBHCs as well, and she went first. So I attended hers and was taking notes for my CCBHC panel and stuff as well. But she does a great job for us, and I just wanted to formally thank her. On the topic of the CCBHC demonstration, so I informed the board last time, our expansion grant ends in April. The demonstration project started in October. We did have that kickoff meeting with our designated collaborating organizations, or DCOs. Just wanted to provide a reminder that there's changes, internal changes that are going along with that as well. We now have to do the all the billing for all of those, the DCOs. So of course we need to add some billing staff internally. We will be billing third party and centralizing the ability to pay. So historically the ability to pay was done at the provider level. We'll be centralizing that at our level. We're also meeting next week in the evening. Richard and I will be meeting with John Villacerda, who's the state's point person over the CCBHCs. We have some questions specific to Macomb because we're unique. We are the only PIHP who's also a CCBHC and a CMHSP and an ABC and an MICKY. Yeah, so we have Judson Center, Hope Network, have CCBHC sites located within our county. CNS is one of our contracted providers. They're a CCBHC expansion site in Oakland, but they've now acquired Northeast Guidance Center, so they'll have a presence in our county. And Easter Seals is also one of our providers. Their CCBHCs has been operating in Oakland County, so we're just trying to get all of that stuff clarified as best we can going forward. It is very much a learning process, and Ann was quoted in my panel about, you're building the plane as you're flying it kind of thing. So this is part of that, but I'll keep you all updated on how that is being rolled out. We've completed now 2 interviews for the CFO position. So we'll be following up with the board, with Megan specifically, with the personnel committee. I'd like the board to have the opportunity to meet the selected candidate or candidates. So we'll be setting that up. And Crystal Buizzi and I had a very nice meeting with the staff from McLaren and leadership from McLaren. They are not a contracted inpatient psych hospital, but a lot of our folks are going to their emergency rooms. Significant numbers, like 20 to 40 people. So collaborating with them, communicating with them, and working on that transition of people from their emergency department to an appropriate inpatient bed if needed, or back into the community with needed supports and stuff as well. So it was very good dialogue, and Crystal and I will be following up on that meeting. And I believe you received some information about the Tri-County Strong from Kathleen. That's specific. It started with the federal grant for the flood services, the people impacted by the flood here in Macomb County. We're also using that for the Children's Initiative. So we've had 2 meetings now. We have a 3rd meeting coming up to see what, as a region, we can do to collaborate to support the needs for children's mental health specifically. So nothing, no action steps yet, but there is good energy, and of course the needs are great in our community. And I think I'll wrap on that.
Thank you, Dave. And just a reminder, we have a full board meeting on the 23rd. And now is the time for hearing of the public. Is there anyone from the public wishing to speak? Seeing none, is there any board member that has anything to add? Seeing none? All right, and we need a motion now to adjourn.
So moved.
That was fast. Megan, motion by Megan and support by Phil. It looks like Phil just said yes. It was Selena. Supported by everyone. We are all in favor, signify by saying aye. Aye. Motion carries.